I think you guys have to come in groups, and then you'll be able to see. I'm trying to spread it open.
Oh.
It's become slippery. Okay, now the diaphragm has a medial crus and it has a lateral crus, okay? And it has a lumbosacral ligament, right? Medial and lateral lumbosacral ligaments. And of course the sternal head arises from the posterior part of the xiphoid process, and then you have the now you see during inspiration there are openings in the diaphragm. You have openings for the esophagus, you have openings for the descending aorta, and then you have openings for the inferior vena cava. The opening for the inferior vena cava is at the level of the 8th thoracic, 10 would be esophagus, and 12 would be the descending thoracic aorta. You have to know this, very important, and you have to study about the development of
So the 8th one is the
inferior vena cava.
Descending.
Okay, I'm getting somewhere now. Now, the medial crus, where does it originate from? Anybody?
Anterior lateral.
Okay. Right. 12 would be the descending thoracic aorta. Now you see, you should know the medial crus as well as the lateral crus. Medial crus arises from the lower 3 lumbar vertebra and its corresponding intervertebral disc. Okay, the medial crus originates from the lower vertebral bodies and the corresponding intervertebral disc, and the lateral crus will arise from the upper 2 lumbar vertebra and its corresponding intervertebral disc. So both this medial and lateral crus will join together to form the domes. You see, these are the domes of the diaphragm.
So, sorry, medial crest is from the lower 3 lumbar, and then the lateral is from the upper 2.
Yeah. Okay. Now here you see. All right. Looks a little bit barbaric, eh? Okay. Okay.
Feel that. Even spirit isn't supposed to feel that.
Okay. No, because I want you guys to have an idea. You see, this is the lung.
Yeah.
All right. This is the dome of the diaphragm. And here you see, you have the heart with the pericardium. Okay. I wish somebody could wear a glove and, you know.
Use your glove.
Okay.
Glove and do what?
Well, let me see. He went it back.
I mean, you got it back.
long did it take me to put it on?
All right. Now what I'm going to do,
See the heart, you know? We'll learn the heart already. We'll put to the heart now. Too bad it's not that together.
So what's that structure that you're moving back now?
this is the pericardium, part of the pericardium. You see? This again is the pericardium, which covers the heart. We are dissecting here. I'm taking out, remember the pericardium has parietal and visceral again. Yeah, fibrous and serous pericardium, which we'll discuss when we discuss the heart. So, I'm splying open the pericardium. And as you see, this pericardium has an apex and it has a base. Base is continuous with the diaphragm. Apex is continuous with the great vessels that are present on top. Okay? You see, this is the pericardium. I'm just reflecting the pericardium out here. All this will be pericardium. I'm just cutting it.
Break open the rib cage like you did before?
Not with this, you know. Okay.
Use the ribs again.
You see, this is the, what is the structure what you see here below? Below the right dome.
Right.
Okay, what you have to understand, this diaphragm forms a right dome and the left dome. So the right dome is related to the liver. The left dome will be related to the gastric fundus and spleen. Okay, right dome and left dome. So in the midline you have the central tendon. So what we have reflected here would be the left dome. I'm trying to reflect the right dome. You see, this is part of the right dome. Somebody fell down?
Oh my gosh. Everybody's okay? Okay.
She's laughing. She's cool.
Alright.
All jump at once.
She was going on for like 5
Now here you see, this is the opening in the diaphragm. This is for the inferior vena cava. You see, this is the heart. Okay. So where does the inferior vena cava drain into? Alright. So here you see, this is the opening for the inferior vena cava. Now we have to identify the opening for the esophagus as well as the descending aorta. Alright?
Huh?
Yeah, this inferior vena cava opening will be at T8. And then you have the esophagus which will be at T10. And then lower down will be the descending aorta that will be at T12. Yeah.
Hold on. Is it the esophagus at T12?
T10.
T10.
Esophagus is at T10. So to identify the descending aorta, we need to take out this lung here.
That's going deep
The
though.
lateral fossa is at the upper 3 lumbar. Inferior vena cava. And then this is the lower 3 of what?
Lumbar vertebrae. This is upper here and this is lower too. Makes sense.
It's at level of T10, T8, I'm sorry.
No, it's descending aorta at T12.
Or That's the phonics thing.
Definitely not too orthopedic.
It's going so. There you go. Why would you feel sorry for it?
I'm just taking out the. Right.
You walk low?
So that we can appreciate the descending aorta.
Same response.
Wow.
5, 8, 10, 12. C. Descending. Oh, that's good. That's good. That's very nice. Nice. That's good. Using maybe I should use it this time. Hearing the words and seeing the building.
I can't say so.
This can't be surgery. This is bad.
Cool, man.
Can you see the cardiac nut?
So let me take off this part so that you guys can appreciate it better.
Right there,
I can't read the cardiac function this one, man.
Yeah, I see. Is that this? That's this?
The tongue structure.
You were right. It was the apex of the lung.
This is also a bit sharper.
You're cutting bone. Suppress
Can you
it.
just take a glove? Just put it.
the left side.
That's good. Okay, then measure.
Good job.